Howdy farmies, welcome to our first ever episode of EBM Doodles. Today we're going to be teaching you about the various types of epidemiological studies, so put on your thinking caps and let's go.
Pharmacoepidemiology is the study of disease patterns and medicine use in a population. It has the potential to spot adverse events, risk and benefit, associations, and causal relationships. As pharmacists, we need to be aware of the various types of epidemiological studies and their characteristics in order to ensure that we have the basis to identify studies that are the most valid and reliable, and can thus inform evidence-based clinical decision-making.
Epidemiological studies can be divided into two main sections, namely experimental studies and observational studies. The different kinds of studies which fall under these two sections include randomized control studies, quasi experiments, cross-sectional studies, cohort studies, and case control studies.
Randomized control trials are the gold standards for showing causal relationships. In these trials, every member of the sample group should have an equal opportunity for being placed in either the treatment or control group. Preferably, the participants and even the researchers should be blinded during the trial in order to eliminate bias. After dividing the population into respective groups, the treatment group will receive the drug under investigation and the control group will receive either the placebo or the standard of care. Pros of this include the ability to show causal relationships and control for bias, and cons include that it could be quite costly and ethics might come into play.
Quasi-experiments are basically randomized control trials minus the randomization. This method might be used if randomization is impractical or unethical. Pros of this method includes that it is easy to set up and also convenient because you don't have to randomize your participants. However, due to this lack of randomization, selection bias may be introduced.
Cross-sectional studies aim to look at a specific characteristic and outcome in a population at a specific point in time. Take this population of sheep for instance. Some of them like eating green grass while others much prefer the yellow grass. The farmer saw that some sheep developed chronic diarrhea and realized that the grass they were eating might have something to do with it. So he decided to examine how many of the sheep eating the yellow grass had diarrhea compared to those who were eating the green grass. This type of study thus provides information about the prevalence of disease. Pros of cross-sectional studies are that they are relatively inexpensive and efficient to conduct, but they may introduce confounding bias.
Cohort studies aim to show the incidence of a specific event in a population with a specific exposure. Going back to the sheep, the farmer noticed that some sheep like to smoke, and he wanted to find out whether the smoking may lead to the development of lung cancer in these particular sheep. So he followed them for a specific period of time, and noted all of the sheep that developed lung cancer in that time frame. Pros associated with cohort studies include that it is useful in showing associations between exposure and outcome, but they might be very time-consuming and costly.
Finally, case control studies aim to consider an event and utilize records and recall to determine associations between specific past exposure. These poor sheep developed diabetic foot and had to have one of their legs amputated. The farmer wanted to find out what was the cause of this diabetic foot. He examined the overall consumption of gin and tonic amongst the sheep to determine whether there was a notable association. Pros of case study include that they are relatively inexpensive and efficient, but subjected nature of data collected may introduce potential biasm.
And that's it for today, farmies. If you enjoyed our video, give it a thumbs up and subscribe.